My name is Dr. Garcia. I'm here to talk about Prolozone today. Prolozone is a regenerative injection therapy. I'm going to talk about its usefulness in osteoarthritis and specifically the knee. Osteoarthritis, as you know, is going to be a degeneration of the cartilage in your knee caused by different factors, age-related, past injuries, repetitive stress. These types of things interfere with it. So with osteoarthritis, you have a degeneration of the cartilage. Now, the cartilage doesn't have its own blood supply. It relies on diffusion from the tissues around it to get nutrients and oxygen, and sometimes the synovial fluid that's inside of the joint itself. Now, with age and with repetitive stress, a lot of this synovial fluid kind of goes down, and the cartilage isn't getting everything it needs to keep itself healthy and regenerative. You also have blood supply issues. And as we get older, some of the vessels in our body narrow, which limits our blood supply. And when you have inflammation around the knee, that causes a lot of pressure, which also interferes with your blood supply. Now, I would like to talk about Prolozone. So Prolozone uses procaine, it uses nutrients, and it uses ozone to affect the joint and help it to kind of regenerate. Now, procaine is considered a local anesthetic, but it also has been used or known to be used for regulation of the nervous tissue or nervous system. It also aids in the regeneration of tissue. It serves as a vasodilator, expanding the vessels so that more blood supply gets there. So that's the reason why we use that there. You have ozone. Ozone is going to be a mixture of oxygen, O2, and O3. So O3 is kind of reactive, so that extra molecule will actually interact with things around it, including the membranes, the cell walls of viruses, bacteria, and funguses. And it can cause them to become inactive, which helps with less of a chance of infection during the injection process. Ozone has also been shown to allow blood cells to release more oxygen into the tissue around it, and it affects the cell membrane of the red blood to become more flexible so that it's able to get through narrow passages and get through our body a lot more. So you have Prolozone, which helps with your pain. It helps with nutrients to the joints. It helps with oxygen to the joints, and that stimulates our body's natural regenerative process.